I'm Shannon Landauer with the Iowa Lakes Corridor. We're excited to bring a video series to highlight manufacturing projects celebrating Manufacturing Week, as well as other significant employers and projects throughout the area, focused on economic development in our four-county region. Today we get to interview Bill Bumgarner, CEO at the Spencer Hospital. So Bill, tell us a little bit about your role.
Yeah, I've been the president of Spencer Hospital since 2009, and prior to that, I served as the president of Vera Holy Family Hospital in Estherville for 9 years. And actually, I started my career in Spencer back in 1982, a long time ago, and then moved around a bit as my career advanced, and was happy to return back to the Iowa Great Lakes region again in the year 2000.
So it's home.
It is.
That's wonderful.
Yes.
So you've had some history in the area, but let's talk a little bit now about the expansion project at the hospital. When we take a look at that through the economic development lens, it isn't just investment and jobs created. It's making an impact with other employers, and really these are long-term projects to stabilize healthcare opportunity in the region. So let's talk a little bit about that expansion and the hospital.
Sure, yeah, absolutely. We just this month initiated a project to construct a new emergency department. There'll be a range of other campus improvements related to that as well. The primary objective is simply to modernize our emergency department and to have it have more visibility. Right now it's kind of tucked into a corner of the hospital campus. The new structure will be on East 11th Street between the Medical Arts Building, where Avera Medical Group Spencer is located, and the hospital building itself. And it will greatly improve visibility and public access. The design of the building will match other prominent areas of the hospital. So we see it as going to be a real significant improvement to our campus. It's also going to improve care opportunities and the care process for our patients. It'll be larger. We'll have more treatment rooms. We'll have a couple trauma rooms, a couple rooms specifically designed for the care of behavioral health patients. We're going to be using what we call an on-stage, off-stage type approach, where there's a center core where our doctors and nurses and other care providers work. It really increases privacy for patients receiving care. We're going to have a larger waiting room, well-lighted. We're also going to be improving our ambulance facilities as well, the ability to have two ambulances in a garage connected to the ED at the same time. Serves a couple of purposes, one for our own ambulance, but also other ambulances that come from other hospitals around the region as well. So it's going to be a much a more modern facility responsive to the care needs that we face today.
Along with the geography of where you pull employees from, talk about your patient impact and how big of an area you serve at the Spencer Hospital. Spencer
Hospital is a real interesting hospital because in a lot of ways we're a community hospital. We know a lot of the people that we care for each day. They may be our neighbors, we might know them from church, they might be former classmates, whatever the circumstance might be. But we're also a regional hospital. We offer unique services in Northwest Iowa, our cancer center, our two dialysis centers, one here and one in Spirit Lake, our inpatient behavioral health services. We draw a lot of patients to Spencer Hospital because of the surgical services and specialties that we offer. So depending on the service, we'll draw folks from throughout Northwest Iowa. Our behavioral health unit, over a period of time, we'll see patients from every county in the state of Iowa.
Wow, that's amazing. So transitioning a little bit, as we've talked about, you've really had your heart in Northwest Iowa in the corridor region for many years. So talk to me a little bit about your reason for getting involved in the Corridor Board and helping lead us through our growth and transition of the Iowa Lakes Corridor Development Corporation?
Yeah, I think like for a lot of folks, back when I was working in Estherville, in Emmett County, I was asked to serve on the Corridor Board, and I served on the board for 8 years. Actually, I was a representative from Emmett County for a period, and I relocated to Spencer. I continued my service on the board. I was the chair for 2 years, and really enjoyed that. And I think for me, the things that came from that, I really discovered more and learned more about the 4 counties in the corridor, what they bring forward. I also learned that some of the complexities involved in recruiting businesses to the area, developing housing, which is a challenging need, which I think we're making great progress in the corridor currently, but it's not an easy thing, to do. And I guess also what I came to learn and really appreciate is the focus that was placed on entrepreneurship and helping existing businesses to grow. And one thing I really, really thought was a wonderful idea was partnering with schools to make our youth aware of opportunities in manufacturing and the trades in the region. I think that's also very, very, very important to do that. And I guess to summarize that is, I think people who don't work in economic development are always expecting that economic development home run. And what I learned is it's really about collecting those singles and doubles. You're going to get an occasional home run, but really it's the singles and the doubles that you hit that really help make progress over many years.
That is so true. And coming into the corridor as the new president and CEO, I just found it fascinating, the approach of the 4-county area, so that we really could bat above our class and really be competitive in a different way. Certainly with offering all of our different communities that have their unique assets, but healthcare is also a part of that. So talk to me about your thoughts with the regional economic development approach as it relates to your business and, again, economic development as a whole.
Oh, sure. Absolutely. The corridor is really fortunate. We have 4 high-quality hospitals, one in each of the 4 counties. And probably what, again, public might not realize is, why each hospital works at its own strategic plans and initiatives to meet the local needs. We do collaborate around a range of services. A lot of that is around physician recruitment. We share a lot of the same specialty doctors. And we come together quite frequently. We're in a number of different joint business arrangements amongst the various hospitals. So I think sometimes people look at businesses in the corridor competing, and there's always some element of that, of course, but I would think there's more collaboration, and it's really helped to advance, I think, the overall outcomes related to healthcare in the corridor.
Right. So thinking about your vision for growth at the hospital and thinking about the corridor as a whole, how do you see that? Or talk to me a little bit about what you see in the corridor and just the opportunity in this region.
Yeah. Well, I think as you stated earlier, we will accomplish more together than we will working separately. And in rural areas, I just think that's essential that we understand that. And we've been so fortunate that that's what's been occurring in the corridor area. I mean, when you really look at it, is in Dickinson County, obviously, you've got the finest outdoor recreation area in the state. In Buena Vista County, we've got a tremendous 4-year college. And in Clay County, a regional hospital that offers a wide range of medical specialties. And then, of course, in Emmett County is the home of Iowa Lakes Community College, just an outstanding community college system. And then when you get to the local level, all of the communities have wonderful schools, great healthcare systems, as we've already touched on, exceptional government services, Then you get into all the service organizations, the entertainment, the businesses, the arts. There's just so many different elements to that. And there's a lot of collaboration there too, that people don't always understand as we help each other to grow and advance. And, I just look at it as an economic development success in any of the 4 counties should be applauded by all 4 counties, because it does help lift us up a bit. And I guess more than anything else, I guess my observation is we've gotten a long way by growing together rather than growing apart. And that's been, I think, one of the keys to the success of the Iowa Lakes Corridor region.
I completely agree. I think we'll leave it there. Amazing thoughts and very much appreciated. And congratulations on, again, the growth. And thank you for investing your time at the hospital and in economic development and all the things you've done in the region.
We're happy to do that. Thanks for having me today.